Hello, I'm Jeanne Tung, one of the pediatric gastroenterologists here at the Mayo Clinic. Today I would like to talk about two studies that were presented at the 2014 Advances in IBD conference this last December. This was a study by Dr. Marat Kotsky and her colleagues at Boston Children's Hospital. They were interested in studying the brains and cognitive function of children with IBD. Now, cognitive function or cognition is how your brain produces thoughts, processes information from your senses, and creates memories. In the first study, 12 preteens and young teenagers with Crohn's disease had MRI scans of their brain. All of these patients were on steroids due to a flare of their Crohn's. These MRI scans were also compared to healthy children that did not have IBD. They also took tests of memory, IQ, emotion, and attention span. In patients with Crohn's disease, a portion of their brain called the cortex was a bit thinner than healthy children of the same age. The areas of the brain that had a thinner cortex play a role in cognition and emotion. Those who were on higher doses of steroids and had higher inflammatory markers in their blood work were more likely to have this thinning of their cortex. In the second study, they interviewed 85 children with Crohn's disease and compared them to healthy children. They examined school records, tests of memory, and IQ. The Crohn's patients in this study were more likely to have trouble with memory, even if they were in remission. They were also more likely to have issues at school, including general school problems, use of a 504 plan for academic reasons, and the need for special education classes. Now, some of these numbers may seem high that we've listed below, and in the first study, all of these patients were on steroids. What I would take away from these studies is this. First, if possible, avoid steroids or discontinue them as soon as you can. Second, work with your gastroenterologist to find the treatment regimen that will get you in remission or get you back in remission. And third, work with your school teachers to look for any emotional or learning issues for your child. A formal test of their IQ and learning ability may or may not be necessary. If there are issues found, work on an individualized education plan, otherwise known as an IEP, to get the resources that you need. I hope this was helpful today.